So this whole topic is going to be based on the life of Shanti, Saroja and Suresh. So let me introduce them to you. Shanti is an expecting mother who dreams of a beautiful journey of motherhood. She has about 10,000 Instagram followers and wishes to become a parenting influencer soon. She has a mother-in-law who is Saroja and she wants a big fat grandchild. Suresh is a doting husband and supports her Instagram social page always. You can see two profiles of Shanti. That's because when she's happy, she's like that. But when she's stressed about breastfeeding, she comes into a different mode. Let's see how we can keep Shanti happy. So Shanti first registers into the Vijaya Hospital antenatal and visits to Dr. Mala's office. Now we want Dr. Mala to let us know how and when do we prepare mothers in the antenatal period for breastfeeding. Do you advise nipple therapy in the antenatal period?
Good afternoon, everybody. The preparation for breastfeeding begins right from the first visit onward, where the breast examination is a part of our complete assessment of the patient. If there is a problem, we identify it and we gently tell them at that time that your nipples are flat or slightly inverted, but we start instituting treatment as such for it only a little later, maybe after 5 months or so. Every time breastfeeding is reinforced, like when they complain that their breasts hurt, we tell them it's because your breasts are growing and getting ready to feed a newborn child soon. And at delivery, at 36 weeks, we prepare them for breastfeeding as such by looking after the breast, getting it clean, and also telling the patients that they would have to start hydrating themselves soon and eating well. That, of course, happens right from the beginning. We try to make the deliveries as painless as possible. We are very generous with analgesics so that patients are not traumatized too much after that and too stressed to feed normally. And after delivery, actually, we institute feeding and all soon enough so patients can be put into the breastfeeding mode as soon as possible. Diet after that is stressed on as are supplements. And we have an excellent team of sisters who patiently look after the patients while for breastfeeding. Never turn a bad face when they are called multiple times, and we encourage that. So and in the antenatal period, do you give any nipple therapy, madam? We are at the antenatal phase. I just tell them an exercise with the thumbs at the base of the nipple, which sort of when you dip it down, the nipple comes up to some extent, protrudes out. And that till 5 months, I only tell them that. After 5 months, we can tell them to go online, look at the methods available, like say nipple puller, and see if they can afford it and whether they would like to use it.
Thank you.
But all said and done, in the end, there is one piece of advice I tell them, that even if your breasts are flat and they don't come up whatever you do, we will find a way for your baby to latch and feed.
So we all know in the antenatal period, we need to have a look at the nipple and sensitize the mother. Yes, there may be needed first support after delivery. So now Shanti dreams of prenatal classes. She wants to video this session. And are prenatal classes really needed to support breastfeeding? Have they made a difference in breastfeeding rates? I would like Ms. Teena to answer this.
So good evening. So mostly mothers think that in prenatal classes they dream about labor sessions and exercise, self-hypnosis techniques and everything. But most important thing during antenatal period is learning at least the basics of breastfeeding. So that is very, very important, because we should know how our body is developing, how our breast is developing during the phase of pregnancy. So we will cover the basics of development and how to hold the baby and latch and everything in the prenatal classes. And when it comes to the difference of breastfeeding rates after finishing of the sessions, definitely yes, because they are more aware about their body and choices. if they're not developing physiologically, they have a choice to meet a person who's going to help after delivery. And we will be creating a group during antenatal period, and we will provide a chance to meet a postnatal mother, and they'll be wondering like, oh, is that a difficult job? I thought labor is the most difficult thing to do, but it is very easy comparing with breastfeeding. So when we put on all these stories and testimonials from the postnatal mothers, they are very much prepared to face the breastfeeding journey and look for help.
So we all know that prenatal classes are available, and they do make a difference in postnatal breastfeeding establishment. It gets the mother mentally prepared and the family also prepared. Now, Shanti is a very Instagram savvy person. She gets to see something really nice, and she says, what is this? What is this antenatal colostrum harvesting? Have any one of you heard about it? Yes, Miss Teena, it's for you.
So I think it's quite popular nowadays because of Instagram, and I think most of the Western mothers are using it. According to me, we don't have the right kit available in India. So we should have a goal to do it. Not everybody can do it. So maybe if you have diabetes mellitus, or let's say you developed gestational hypertension in between, and you're on labetalol or some other support medications, or you're going to deliver a twin baby, or you have poor glandular tissues. So in such cases, you can definitely work on. Lactation professionals will guide you how to do the expressions and how to store, and you can offer. So, and most importantly, if your baby needs NICU admission, in some cases, we will be expecting our baby will be maybe 30 days or 40 days in the NICU. So during that phase, we can use this colostrum for a better purpose.
Okay. So there are some mothers who leak out colostrum during 32, 33 or 34 weeks. They may not even know it's colostrum leaking, and there are now kits available which you can collect the colostrum, freeze it, and use it when the baby is born. So that's colostrum harvesting, which is in trend now. So now Shanti comes across a breast milk donation campaign. With increasing awareness about breast milk donation, I'm posting this question to Ms. Rupa. Do you see a need to sensitize? Is it necessary that we have to talk about milk donation in the antenatal period? Have you given a thought of doing this?
Yes, definitely. First of all, good evening to everyone. எப்படி தாய்ப்பால் பற்றியும் தாய்ப்பாலோட பெனிஃபிட்ஸ், அதோட நம்ம பிரெஸ்ட் ஃபீடிங்கோட பெனிஃபிட்ஸ், இதை பற்றி நம்ம எப்படி சொல்லிக் கொடுக்குறோமோ அதே மாதிரி பிரெஸ்ட் மில்க் டொனேஷனை பற்றின இம்பார்ட்டன்ஸ், அதோட பெனிஃபிட்ஸ், அது யாருக்கு போய் சேர்ந்துருது அப்படிங்கிறது ப்ரெக்னன்சி பீரியட்லேயே சொல்லிக் கொடுக்குறது ரொம்ப ரொம்ப அவசியம் தான். ஏன்னா ஆஃப்டர் டெலிவரி அவங்க நிறையா ஹார்மோனல் சேஞ்சஸ், நிறைய விஷயங்களை அவங்க ப்ராக்டிக்கலாக எக்ஸ்பீரியன்ஸ் பண்ண ஆரம்பிச்சிருவாங்க. மற்ற விஷயங்கள தியரட்டிக்கலாக படிக்கிறதுக்கும் ப்ராக்டிக்கலாக அவங்க எக்ஸ்பீரியன்ஸ் ஆகிறதுக்கும் நிறைய வித்தியாசம் இருக்குது. ஸோ ஆஃப்டர் பேபி பார்ன் அவங்களோட எல்லா விஷயமே அவங்க ப்ராக்டிக்கலாக அனுபவிக்கும் போது அவங்களோட மைண்ட் செட் வந்து வேற லெவல்ல இருக்கும். ஸோ அட்லீஸ்ட் பேசிக் நாலேஜ் வந்து நம்ம டெஃபினட்டா பிரெஸ்ட் மில்க் டொனேஷன் அது எப்படி பண்ணணும், மில்க் எப்படி ஸ்டோர் பண்ணணும் அப்படிங்கிறது ஆன்டினேட்டல் பீரியட்லயே, பிரெக்னன்சி பீரியட்லயே ஒரு மதருக்கு எஜுகேட் பண்றது இஸ் வெரி இம்பார்ட்டன்ட்.
Thank you. So with more and more breast milk banks being planned online, it's very necessary that we sensitize the antenatal mothers that there is a concept called donation. So now we move on. So Shanti, after her antenatal classes, suddenly remembers that she's had a breast augmentation surgery in her early 20s, where she really wanted to look different. How do we address breastfeeding in women after breast surgery? What is the expected impact? I would like Dr. Mala to answer this, please.
There are 4 kinds of breast surgeries that we come across. Breast augmentation, where an implant is put in between the chest wall, the muscle of the chest and the breast. There is not much of an impact, except for maybe a little extra engorgement feeling when she is when milk is just coming, but otherwise breastfeeding should be smooth. The other one is when you reduce the breast size, there are 2 incisions that are made for it. One is at the axilla, which to some extent preserves the glands, breast glands. So they are usually not having a problem feeding if they've had that kind of reduction. But the common incision that is around the areola in a smile way, which can happen for breast reduction as well as for fibroadenoma removal in young girls. They might, to some extent, cut and disconnect the ducts and destroy some glands. These patients should be supported, extract as much milk as they can extract, and the rest maybe if there is some breast milk donation that can be administered. We also had a patient with one breast mastectomy, but she was more motivated because she was told by even her oncosurgeon that feeding is beneficial for the other breast not to get cancer. So she was very motivated and she fed the baby beautifully through that one breast that she had. So that should not really help, hinder feeding except for a little bit for the
So I think, thank you, madam. I think Shanti is safe because she's only had an augmentation. But Ms. Teena, is there any way that you can help this mother breastfeed with better motivation?
Yeah, basically we should educate the mother, saying that if the mother had incision in between, periareolar incision, she might not have the sensation of sucking. So we should educate the mother, saying that you should always check for deep latch, only then baby will gain weight. So we should encourage the mother to feed every 1 to 2 hours, which means frequent feeding every 2 to 3 hours once. In 24 hours, she has to feed at least 10 to 12 times. So that is very important. And other part is we should always check the weight within first 2 weeks. And breastfeeding, after direct breastfeeding, she has to pump. Better she can go for double hospital grade pump. That is very useful for the mother. And if needed, some galactagogues and medications can be administered to promote supply.
So Ms. Rupa, if there's a mother like this who's after a breast surgery, wants to get some milk from your bank, will you be willing to give her?
Yeah, actually we are of a NGO. We actually wouldn't suggest to get donor milk easily, because a mother should breastfeed her baby. That's a basic key role here. As we see here, Shanti is having breast surgery, or any mother is having breast surgery, there is no other chance. If doctor advice for formula, it is okay. Doctor is not okay with formula, baby is having some other thing, we should take over some donated pasteurized donor breast milk. In that case, milk bank can be helpful.
Okay. So finally, yes, you want to add on?
One point, just to want to address the emotional consideration, because mother may feel very guilty because of the surgery. So we should support the mother, saying that we have to accept this, either partial feeding or some help from the donor milk or the formula. Okay. She has to accept and happily feed the baby.
Okay. So before going in for breast surgeries, I think every woman should be aware about these consequences later as well. So now Shanti and Suresh are in the delivery room. Sanjay is born and he's about 3 kgs. I would like Dr. Mala to address what is the ideal time to initiate breastfeeding. How can the obstetrician and neonatologist stick to breastfeeding norms in the delivery room?
We initiate breastfeeding within half an hour in normal deliveries, and mostly within an hour in cesareans, mainly because it's spinal. So they are aware and they're eager, and they would definitely like to bond with their babies as early as possible.
So Dr. Nithya, would you be interested in having the father in the delivery room? When you're actively resuscitating or you're planning to resuscitate, there is a father behind you who wants to do that half an hour feeding.
Yeah, like usually if the child doesn't require any resuscitation, active resuscitation, the child has cried well and the child is fine, we would allow the father to be there and help with putting the child onto the breast of the mother. In case it's a cesarean section where fathers are not allowed inside the OT, our healthcare workers are a very good trained team, and they help to put the child onto the mother's breast so that we start breastfeeding as early as possible.
Okay. So what we want you all to know is whether it's a cesarean or a normal delivery, the concept of early initiation of breastfeeding should exist in every delivery room, and that comes only when the obstetrician and neonatologist are in sync. So whether it's a cesarean or a normal, the concept is after the baby is born, the baby has to be put on the breast. Now, Saroja is the mother-in-law of Shanti, and she wants to decide on the diet. And she wants to know what is diet restriction for new moms to recover from LSES, and what would Dr. Mala advise on the diet?
That we do not suggest any diet restriction, except maybe asking us for advice if some drugs are taken for some unrelated problem to the mother. We start also early diet because of ERA's enhanced recovery after surgery. So by evening, patients are taking water or thin liquids. So there is no restriction, mainly because at least the patients I get do not consume too much alcohol or smoke. So, or do drugs or vaping also. So just whatever they want to eat, they can eat, but not eat for two or whatever that extra this thing that they drink, they have.
Being a mother-in-law, Ms. Saroja is not convinced. She really wants to have some restriction on Shanti's diet. So she goes to Dr. Nithya now, and she wants to ask the pediatrician whether there is any diet restriction for the mother.
No, we particularly tell them that there are no dietary restrictions and the mother should have a complete planned meal. Shouldn't overdo anything, but there should be a mixture of protein, grains, vegetables, fruits, and also some galactagogues, like we always believe fennel, fenugreek seeds, flax seeds, oatmeal, everything increases lactation. So they can include it in that diet, but never overdo, and always have a complete planned meal, a complete diet, so that it has a little bit of everything. And drink plenty of fluids, not necessarily milk.
So there is no diet restriction for a new mom, and she has to keep herself hydrated. So now Shanti wants to have a lactation consultant. She feels that she's not too happy with her breastfeeding, and Saroja says it's an unnecessary fuss. But somehow the hospital has Ms. Teena and Ms. Varsha. My first question is to Ms. Teena. What is the role of a lactation expert in the immediate postnatal period?
So the most important thing is a lot of reassurance, because when it comes to C-section or normal delivery, so they have a lot of challenges in holding, positioning the baby, and if we have to reassure the mother, saying that first 2 to 3 days you will see only few drops, that too transparent, you will not see a proper milk coming in. After educating the mother, we should encourage the mother, father, as well as the in-laws, and educate them to encourage the mother to feed, not to torture her. So saying that, all the time baby is crying, you're not feeding the baby, your nipple is flat, your breast is small, baby is good, but problem is with you, you have to feed formula, or you have to use nipple shield. So we should not give random advice to the mothers and torturing them. So always seek professional help. So initial support, the right information, right time, I would say. So when it comes from the professional, definitely mothers will rely on that information. So they will trust their body, because they nurtured their baby inside the womb. Definitely they have 2 breasts to nurture their baby. Definitely it will nurture. So we should instill this hope into that mother. So that is the important part, I would say. And
so Ms. Varsha, if you are wanting to do the first counseling, what are the salient points that you would like to tell the mother?
First point I would say is, please don't completely dress up and cover your body. Please avoid wearing nursing nightie, nursing tops. See to it the upper part of the body is completely exposed and baby is not completely dressed, at least while breastfeeding, so that they get adequate time for skin to skin, first thing. And even before this first point, first thing I would say is, please avoid visitors in the hospital. Don't ask people to come and visit you in the hospital. I agree, it's a newborn baby and everyone wants to see the newborn baby. If it is after 1 week, 10 days, the baby is not going to grow up instantly. So they can wait for the mother and baby to bond. So I would really say that please avoid having visitors in the hospital. Take a lot of time for skin to skin contact. Try to co-sleep with the baby, have the baby with you almost as much as time as possible. If you're sleeping, then probably put the baby next to you and have an attendant to watch on it so that, you know, your baby is aware when the baby is giving cues to feed or anything. Not all the cry is for hunger, so please watch on that. If the baby is demanding for feed the baby, but don't keep feeding the baby in the thought that baby is hungry. Baby wants the mother. It could be for any reason, not necessary to tag it as hunger. That is one thing. And if the mother is sleeping and, if the mother wants to sleep and if the baby is showing hunger cues, I would suggest the attenders or the mother-in-law, sister-in-law, whoever is there around, don't take the baby away and, leave the mother to sleep, because there are chances that she might end up with engorgement, and baby needs mother. So that also will psychologically disturb the mother. So try to, wake her up, and she can even feed the baby however she is. So these are the main pointers I would want to emphasize at the first level.
So at the first level, we want a good privacy, good dressing from the mother, and make sure that the mother and baby are not separated. Whether she's sleeping or awake, the attendant can always put the baby on the breast and help her. Right. So now the first drop comes for Shanti, and she sees that it's a dirty discharge and it doesn't look like milk. It's so less. How can it be enough? Is it safe or shall I discard it? And when will my milk become white? Yes, Dr. Nithya.
Yeah, we'll have to advise them that this is colostrum, the dirty looking fluid which comes, but that is gold, and that's the first immunization your child is going to get. And overall, colostrum secretion can be maximum of only around 40 to 50 ml per day, but that gives everything the child needs, be it in form of calories or be it the epidermal growth factor that is going to help the child's intestines grow well so that they are ready to start digesting the milk when the mother starts secreting more, or antibodies and immunoglobulins, which is going to give the child immunity against infections in the neonatal period. So everything the child needs is there in colostrum. So we should advise the mother and prepare the mother that she should not discard it, and it is very important for the child. And then we'll also have to tell her the next stage. First few days you're going to have colostrum, which is going to be followed by transitional milk for a couple of days, and then the mother will get the mature white colored milk as we imagine milk to be.
Okay, so colostrum is something which has to be used well, and these transition colors should be notified to the mother as well. So now Shanti is shocked. After her first drop, she realizes there are no nipples. And Saroja is again worried, what was going to happen to my chubby grandson? Is he going to become chubby at all? So now what is the initial support for a flat or inverted nipple to breastfeed exclusively? Ms. Varsha, please.
As I told, it is always better when they have proper skin-to-skin contact with a correct hold. The baby will be able to open the mouth wide to get the nipple deep inside the mouth, and once the baby starts sucking, the nipple will automatically come out. So we particularly will not have to do anything. But the first thing what we have to do is, from the day one of the baby's birth, put the baby in the right position to help the baby suck the milk out along with the nipple.
Okay, thank you. So what we have to reassure her is it's going to be a breastfeeding and not a nipple feeding. Whether the nipple is there or not, the baby will be able to latch on the breast with good support, and that's what we are all there for.
Ma'am, I would like to add one small point. During my training in Pondicherry, there was one mother which we saw. The mother did not have any areola or nipple. It was just the plain skin color, and there was a small mole, and just above that mole there was milk coming out. It was oozing out. There was no breast also. She hardly had any visible breast as such, but luckily the baby correctly went. The baby opened the mouth at that area and started sucking the milk. And later when, I was quite curious to know how it was. So the pediatrician there, I did have his number. So I asked how the baby did. And they told me that the mother exclusively breastfed the baby for 6 months. With that, there's no nipple at all. And the breast was hardly there. So she could breastfeed. So I just wanted to add up this point.
So irrespective of the contour of the breast or nipple, breastfeeding is always possible. But Suresh by then had searched a lot. He went and built himself a lot of stuff. So he ended up buying some nipple former and he ended up some nipple shield and puller. Now I would like Ms. Varsha to let us know, what are these flat nipple accessories? Are they really useful and how long do we use this for?
Actually, I wouldn't recommend using of any of these for some particular reason. Personally itself, I have used these nipple pullers. Believe me, what happens is that areola pad becomes very sensitive because baby's mouth has saliva. It's a very nice soft saliva that when the baby sucks milk, it is a lubrication that does not disturb or trouble the mother's nipple. But these nipple pullers are very dry. Though they are silicone, they don't have any lubrication. So when it is put and when it is pulled artificially, there is a sensitivity issues that happen. So prolonged usage of this. If a mother uses this more than 3 times a day, she starts having a kind of sensitivity when there is a bra fabric that touches the breast also. So that kind of sensitivity that area has. So generally it is better we don't use any of these. Instead of this, there is one small technique that can be done. Cold cloth. Cold cloth actually rubbed around the areola area just before the baby is, about 10-15 minutes before the baby is going to be breastfed. A cold cloth can be rubbed along the areola and then left it air dried. Don't keep anything, so the chillness will go off, and when the baby starts sucking, it does come out. So that is painless, and that is also there's no sensitivity that forms. So these things, it is better we don't use as much as possible.
So we all should be aware such things are there. It can be helpful for some mothers, but not all mothers with such things needs to go on and buy these accessories. Now we move on to the next session. So baby Sanjay is now become thin. He's crying all the time. And Saroja is very angry. Suresh is very confused. What is the alternate feed advice in the initial postnatal period that you would offer for this baby? Dr. Nithya.
So the first thing I would advise is I would like to ensure that the child is getting enough milk. So I would like to check the weight of the child, and I would ensure and I would tell the parents and the attenders that a weight loss till about 10% is very normal in the first couple of days. And the mother also takes a little longer to secrete enough milk for the baby. But they also have to understand that sucking is going to be the most important stimulus, which is going to increase the milk supply of the mother. So that we have to reassure. Then we'll have to reassure when we explain that the child is not losing significant weight, or if it is gaining weight, that the child is getting adequate feeds. The third thing we have to ensure is the child is not going to cry only for hunger. The child can have many reasons to cry, like when the child wants to be close to the mother, wants to be carried, or wants that warmth, the child is going to cry. So we'll advise the mother and the caregivers to take the child, cuddle the child, look into the eyes of the child, talk with the child, and do all these things so that they comfort the child. And the other thing is, we also check the urine output. We don't want to miss dehydration also. So check whether the child is having adequate urine output, any excessive weight loss, and also assess whether the mother is secreting enough milk. So all these things will help us convince the parents.
So don't be in a hurry to buy a formula on day 1. Just look onto the basics. Many of them are solvable. Now she comes on day 2 to meet her OBG consultant, Dr. Mala, with sore nipples. Now how do we handle her? Her breast is cracked and nipple is bleeding on day 2 itself.
The correct method of latching should be explained to her. But in the meantime, we give her emollients so that the nipple heals soon. And a nipple shield is put so that she can feed from the breast without direct pain on the cracked nipple. And it should be explained to her that expression and softening of the breast is very important. Nipple crack is one thing, but an abscess is a totally different thing. So she should not go into that part of breast problems. So I think with this she should, and if it is a single sore nipple, we explain to them that you put your emollient, you go to the other side, see that you're latching well, and so baby is not only tugging at the nipple. And by the time you come back, this area tends to heal also quite fast. So she should be ready for direct feeding again. Only thing, she has to ensure that she's latching well. While going in and coming out, a twinge of pain might be there, but the main objective is met of baby filling his stomach in the right way.
Okay. So every baby or every mother who has a sore nipple needs her breast to be examined and her latch to be re-emphasized. So latching is very, very important. Now Shanti decides to relearn her latch and position because the nipple pain is persistent and weight loss is ongoing. What is the correct latch for her? Can I ask Ms. Varsha to elaborate on this?
Yeah, the first thing about the latch is, as you see, the nose is free to breathe, and areola, maximum of the lower portion of the areola goes inside the mouth. The lips are flanged outward and the chin is lower. The most simpler way to see the latch is the baby having mouth full of breast? Because what happens with the areola pad, trying to check, there are so many moms who have huge breasts and half of the breast is covered with areola. So they get confused, and some mothers, they have a very smaller areola. So with that, it becomes very confusing for the moms to check if the latch is correct or not. And most of the times the moms comes and tell me is, "Mom, baby's mouth is very small. Baby cannot open the mouth wide." So I say, is the baby getting mouth full of breast? சிம்பிளா சொல்லணும்னா, குழந்தை கொட்டாய் விடும்போது வாய் எவ்வளவு திறக்குதோ அதுல 80% வாய் திறந்தா breast feeding successful. So that is what they have to do. And the lip joint that we have, if that is wide open, like for example, how when we pronounce the alphabet how much of our mouth is open? If that is filled with breast, the latch is perfect.
Okay. So now Shanti has learnt everything. She goes and then again she is distressed because she thinks there is not milk coming out of the breast. And she comes to visit Miss Teena. She says there is no milk in my breast. Whatever I press, nothing is coming.
So mostly mothers are, they're not satisfied. So no matter how much ml they express, sometimes 100 ml vandalum milk illan solvanga, 200 ml vandalum milk illan solvanga. They want to express to the maximum. So we should reassure that. So this is quite normal. So don't depress or stress yourself. So and other thing is that we should examine and do the hand express, and if definitely we can see few drops coming in. So we can say that, so see, few drops are coming in. Definitely if the baby is latching, automatically it will come. And moreover, so your body will work on demand and supply basis after delivery. So during that time, so if the baby is taking 8 to 10 times or 10 to 12 times feed, automatically your body will produce. There are certain cases where mothers have low supply. So if the mother has any medical history of certain diseases, in that particular conditions, we have to provide adequate support.
So don't discard any mother's choice without examining the breast. If you think the supply is low, always call the baby for a re-examination after 2 days, and also the mother, so that we don't miss on dehydration and low milk output. Now Shanti reads about Amritam milk donation and she's worried that she's not making enough milk. Now what is human milk donation, Ms. Rupa? And do you sell breast milk for such moms? And can donated milk be given to Shanti's child?
Yeah, first, what is human milk bank அப்படின்னா, எப்படி மற்ற தானத்துக்கெல்லாம் ஒரு வங்கி இருக்கோ, பிளட்டுக்கு பிளட் பேங்க் இருக்கோ, ஆர்கன்ஸ்க்கு ஆர்கன் பேங்க் இருக்கோ, அந்த மாதிரி தாய்ப்பாலுக்கும் ஒரு வங்கி இருக்கு, தட் இஸ் கால்டு ஹியூமன் மில்க் பேங்க். அங்கே என்ன பண்ணுவாங்க அப்படின்னு கேட்டிங்கன்னா, மதர்ஸ் கிட்டேருந்து பிரெஸ்ட் ஃபீடிங் மதர்ஸ், அது அவங்க டொனார் பிரெஸ்ட் ஃபீடிங் மதர்ஸ் வந்து மில்கை அவங்க கிட்டேருந்து மில்கை கலெக்ட் பண்ணி அவங்க மில்க் பேங்க்கில் வந்து ஃப்ரீசரில், தட் இஸ் டீப் ஃப்ரீசர் இன் த சென்ஸ் -20 டிகிரி சென்டிகிரேட்லேருந்து -24 டிகிரி சென்டிகிரேட் வரைக்கும் அவங்க மெயின்டைன் பண்ணுவாங்க. அதில் அவங்க இது ஆக்சுவலி நம்ம இது மார்னிங் மார்னிங் இது பார்த்தோம் டாக்டர் ஷோபனா ஸ்டேஷன்ல, இது ஆல்ரெடி ஹியூமன் மில்க் பேங்க் பற்றி டீட்டெயிலாக பார்த்தோம். ஜஸ்ட் ஒரு அவுட்லைன்னா ஃபர்ஸ்ட் டீஃப்ரீசிங் கான்செப்ட். ஃப்ரீஸ் பண்ண மில்க் பேஸ்சரைஸ் பண்ணுவாங்க. ஏன்னா பேஸ்சரைஸ் பண்ணாமல் பேபிக்கு கொடுக்க முடியாது. வி ஆல் நோ பேஸ்சரைசிங்னா அந்த நுண் உயிர் கிருமிகளை வந்து நீக்கப்படுறது அப்படின்னு சொல்லுவாங்க இல்லையா. லைக் பாக்டீரியா, ஃபங்கல் இன்ஃபெக்ஷன்ஸ்லாம் அதில் ஏதாவது இருந்துச்சுன்னா அதை நீக்கப்படுற அந்த +62.5 டிகிரி சென்டிகிரேட்ல அந்த மில்கை ஹீட் பண்ணும்போது அதில் இருக்க சில பாக்டீரியாலாம் செத்து போகும், அந்த கிருமிகள்லாம் செத்து போகணும் ஒரு கேஸ் ஸ்டடி இருக்கு. நெக்ஸ்ட் அதை தாண்டியும் நெக்ஸ்ட் என்ன பண்ணுவாங்க, ஸ்கிரீனிங். அப்சல்யூட்லி ஸ்கிரீனிங் இஸ் வெரி இம்பார்ட்டன்ட் ஃபார் எவ்ரிதிங். அப்போ இந்த ஸ்கிரீனிங் பண்ணும்போது மைக்ரோபயாலஜியில் டெஃபினட்டாக அதில் எந்த மில்க்கும் ஸ்பாயிலேஜ் இல்லை, பாக்டீரியல் க்ரோத் இல்லை அப்படின்னு தெரிஞ்சதுக்கு அப்புறம் தான் பேபிஸ்க்கு அதை கொடுக்கறதுக்கு அந்த மில்க் வந்து எலிஜிபிள் அப்படின்னு சொல்லுவோம். இந்த கேஸில் சாந்தியோட கேஸில் பார்த்தீங்கன்னா அவங்களுக்கு இப்போ தான் மில்க் சப்ளை பற்றி டவுட் ஆக ஆரம்பிச்சிருக்கு. அவங்களுக்கு மில்க் சாட்டிஸ்ஃபை ஆகலைன்னு அவங்க நினச்சிட்டு இருக்காங்க. அந்த கேஸில் அவங்களுக்கு நம்ம மில்க் பேங்க்லேருந்து மில்க் ப்ரொவைட் பண்ண முடியுமா, ஃபர்ஸ்ட் ஸ்டெப்பே நோ தான் சொல்ல முடியும். ஏன்னா ஃபர்ஸ்ட் அவங்க பேபிக்கு அவங்க ஹெல்த்தியாக இருக்குங்கிற பட்சத்தில், அவங்களுக்கு எந்த ப்ராப்ளமும் மெடிக்கல் ஹிஸ்ட்ரி எல்லாமே ஓகேங்கிற பட்சத்தில் அவங்க டெஃபினட்டாக அவங்க பேபிக்கு அவங்க தான் பிரஸ்ட் ஃபீடிங் பண்ணி ஆகணும். ரொம்ப ரேர் கேஸில் மதனால ஃபீட் பண்ண முடியல, பேபிக்கு வேறு எந்த இதுவுமே கொடுக்க முடியல, ஒன்லி டொனாட் பிரஸ்ட் மில்க் தான் ஆப்ஷன் அப்படிங்கும்போது டெஃபினட்டாக மில்க் பேங்க்லேருந்து மில்க் ப்ரொவைட் பண்ணுவாங்க வித் ப்ரிஸ்கிரிப்ஷன் ஃப்ரம் டாக்டர். லைக் மில்க் பேங்க்லேருந்து மில்க் வந்து சேல் பண்ண மாட்டாங்க. பிகாஸ் இன் அவர் கண்ட்ரி இட் இஸ் அகேன்ஸ்ட் த லா. செல்லிங் யூசிங் பிரஸ்ட் மில்க் ஃபார் கமர்ஷியல் பர்பஸ் இஸ் வெரி இல்லீகல். ஸோ டெஃபினட்டாக பிரஸ்ட் மில்க்கை சேல் பண்ணக்கூடாது. ஸோ அந்த மாதிரி ரேர் கேசஸ்க்கு இஃப் டாக்டர் ப்ரிஸ்கிரைப் டெஃபினெட்லி மதர்ஸ் கேன் கெட் டொனாட் பிரஸ்ட் மில்க். பட் ஒன்லி இந்த ரேர் கேஸ், மதர் ஹெல்த்தியாக இருக்காங்க, அவங்களால பிரஸ்ட் ஃபீட் பண்ண முடியும், பிரஸ்ட் மில்க் அவங்களுக்கு ப்ரொடியூஸ் ஆக முடியுங்கிற இருக்க கண்டிஷன் அப்போ 99% ஆஃப் த மதர்ஸ்க்கு வந்து மில்க் பேங்க்ல மோஸ்ட்லி கவுன்சிலிங் தான் கொடுக்க ட்ரை பண்ணுவாங்களே தவிர மில்க் ப்ரொவைட் பண்ண ஃபர்ஸ்ட் ஸ்டெப்பை ட்ரை பண்ண மாட்டாங்க.
So, Madri 4 days ஆயிடுது and Shanti is looking to settle. She's happy with the latch, but now she's worried that the baby is sleeping too much on the breast. She's not sure if the baby is actually sucking for 20 minutes, but she's seeing a count of the urine. Urine is about 6 times and the poop is around 2 times, and now she becomes anxious again and she goes to meet Miss Varsha.
See, if the baby is actually having enough pee count and baby வந்து சரியா latch பண்ணி கரெக்டாக குடிச்சாங்கன்னா ஆக்சுவலாக அவங்க பயப்பட வேண்டாம். ஸோ அந்த ரீஅஷூரன்ஸ் அவங்க வந்தாங்கன்னா கூட, இப்போ சாந்தி என்கிட்ட வந்தாங்கன்னா கண்டிப்பாக ஐம் கோயிங் டு டெல் பேபி ஃபஸ்ட்டு கேட்குற கேள்வி, பேபி யூரின் அவுட்புட் எவ்வளோ, பேபி நல்லா குடிக்கிறாங்களா, குடிக்கும்போது உங்களுக்கு அந்த ஃபீல் தெரியுதா, do you have any discomfort, ஃபீட் பண்ணும்போது ஃபீட் பண்ண ஆரம்பிக்கும் போதோ இல்லை நடுவுலையோ இல்லை ஃபீட் பண்ணி முடிச்சதுக்கு அப்புறமா ஏதாவது டிஸ்கம்ஃபர்ட் எங்கேயாவது இருக்குதா, அப்படி எதுவுமே இல்லாத பட்சத்தில் யூரின் அவுட்புட் கரெக்டாக இருக்குன்ற பட்சத்தில் then I would suggest you don't have to worry, just continue அப்படின்றத சொல்றது. பட் இன்கேஸ் அவங்களுக்கு அந்த பேபி வந்து அங்கே பிரெஸ்ட்ல இருக்காங்க அப்படின்னும் போது only thing I would ask her to do is skin to skin கொஞ்சம் ஜாஸ்தி பண்ணிக்கோங்க. probably baby loves to be with you, baby loves your touch, உங்களோட அந்த ஸ்மெல் பிடிச்சிருக்கு, உங்க கூட இருக்கிறது பிடிச்சிருக்கு, ஸோ அதனால just carry the baby.
Okay, so if the urine and the poop counts are decent, we shouldn't jump on concluding about inadequacy of milk in the first week of life. So she's about 9 days into her delivery, but she's still come back with a painful breast to her OBG. Someone has told her about a blocked pore. She's come to Dr. Mala's office and she's shown her breast and the breast looks like this.
First and foremost, the breast itself should be examined first to see that there is no mastitis signs or impending mastitis or breast abscess. But blocked pore is very visible on gently squeezing around the areola. There will be drops of milk coming from everywhere except one place, which will be like a bleb. And that's usually either while feeding the baby has eroded that area so that there's skin coming over it, or there is a blocked inspissated milk there, which because of which from there it's not coming off. So it depends on what we are seeing. If we see a bleb, we take a sterile needle and just gently puncture it and again squeeze, and you will find that there will be an initial pain because this inspissated milk when it comes out is not exactly painless, but it's temporary, and then afterwards milk starts flowing and they can be reassured that it's a solved thing now. How do you prevent it coming again? The patient has to feed a little more often and probably drink a little more water. Hydration is all important while feeding, so that will prevent her possibly from getting this thing again and again.
So madam has put up an important notice that hydration is very important for mothers. So on the 10th day, Shanti has persisting pain with full breast. Dr. Mala has ruled out a mastitis and sends her to the lactation consultant. The lactation consultant sees that and she feels that the breast is reasonably engorged. And what would Miss Teena do about this? And does this have any role of cabbage leaves or pumping to be started for this mother?
So firstly, so we should encourage the mother to feed frequently. So that is very important. Most of the times what happening is once they develop these engorgement and mastitis, they immediately want to wean off. So that is not a right time to wean off. So we have to encourage the mother to do very frequent feeding. So after which, if she feel like it's very hard or heavy, can't able to handle, it's very paining. So then she can go for cold compress, not the cabbage leaves. So we don't have any evidence supporting that cabbage leaves will reduce the. It will reduce obviously because of the cold temperature. So but if we keep using these cabbage leaves, we tend to develop bacterial infection. So we will not suggest cabbage leaves for the mother who have mastitis as well as the engorgement. So you have to feed the baby frequently. You can use cold compress. If it is very hard, you can go for warm compress, feed the baby, then cold compress. So that will, it should resolve within a week. If it is not resolving, definitely you should see your OB-GYN. So from there, her OB-GYN will guide. Yeah.
Okay. So that's good. After a terrible 10 days, Shanti has gone into the 4th week of her life. She's very relaxed. She's become Insta-active and she started posting all her breastfeeding journey. And then she suddenly feels her breast is no longer hard and there is no dripping of milk. She finds the baby fussy and she visits Miss Teena again with a lot of worries.
Yeah, this is a common thing because initial days they will undergo different composition of milk. I would say that initially they will start with 80 to 90% of whey protein. So they feel like their breasts are heavy, engorged and full and leaky. So maybe after after a month, it completely depends relies on demand and supply. So they'll not feel like it's heavy or leaky. And moreover, baby's milestone will also develop. So after 4 weeks, during night times or evening times, baby will not sleep. So they need mother for comfort, or every time when the baby cries, all the parents and relatives will suggest that baby is hungry, you're not having milk. So which makes the mother even more worried. So we should reassure that you have enough milk to feed your baby. You have to trust your body, and every week your body will secrete unique milk. Your breast milk is tailor-made according to your baby's demand. And if we start explaining all that, she feel kind of comfort. Maybe after a week also she will text you that she is not having milk.
Good. So the growth spurt starts in babies at around 3 weeks. So they become extremely fussy and they have a lot of feeding habit then. So that time the breast doesn't have enough time to fill up and feel engorged. So you might have to tell the mother this is a normal course. Somewhere around 2.5 months to 3 months, this phase will settle. So now, but Shanti is not convinced. She wants to know how much she's really lactating. So she wants to pump now. Shanti's husband decides to give a pump as she's been wanting it so much. When should Shanti pump and what is a good pump for her, Miss Varsha?
Usually it is advisable not to use pump for at least minimum 6 weeks post-delivery, provided if the baby is in the NICU or the baby, there is some medical emergency, then yes. Otherwise, for Shanti, she will not need any breast pump. But yes, there are breast pumps available in the market. There is a manual breast pump. There is a electric, handy electric breast pump. There is double electric breast pump. And there's also something called a Haka cup. That is a milk collector cup. So when there's always there's a place where one side when the mother is breastfeeding, the other breast starts leaking. So what they use is, they use this cup on the other side and collect the leaking milk alone. So these are the things available in the market, but it is better not to go in for a breast pump at this early stage.
Okay. So she's decided that this is not the time for Shanti to use a pump unless she has any other emergency. Now suddenly Shanti remembers when she was 15 days, she started with less milk supplied by her mother-in-law. She sees her grandson stretching and fussy and always clinging to the breast. She wants to start cow's milk because the baby is not feeling good. She's waiting for Dr. Nithya's approval.
So the first thing we have to reassure is check whether there is enough milk, whether the weight gain is sufficient, the urine output is good, whether the mother is feeding the child at least 8 to 10 times a day. All this we have to first check and then reassure the mother, because lack of self-confidence or feeling that she is not going to secrete enough milk is going to be the biggest hindrance to establishing proper feeding. So if the mother starts thinking that she's not going to secrete milk, definitely she will not be secreting milk, and people around her telling her that probably you're not secreting milk is going to demotivate her more. So the first thing is, you'll have to counsel them as a family. Counsel the mother-in-law, let the mother-in-law and the husband, everyone listen to what you're telling the mother. If the mother goes and tells this is what the doctor says, they're not going to believe. So see to that everyone listens to all these things. And the other thing is, cow's milk is going to be a big no-no. Whatever be the reason, it is not going to be cow's milk till about 1 year of age. And the main thing, if the child is stretching, fussy and everything, it can be colic also. After a couple of weeks, the child can start getting colicky, where the child will be stretching, and even a normal child can be fussy at times. So if the child is going to be not fussy, has a good sleep after at least a couple of feeds, peeing at least 6 to 8 times a day, and the mother is feeding the child 8 to 10 times a day, including night feeds, and the weight gain is good, the mother has to be reassured that she is secreting enough, and there can be other reasons for all this. The commonest reason sometimes is just nasal block. If the child is going to be having nasal block, the child is going to be having mouth breathing, and that also will make the child a little fussy and stretching. So we'll have to look into all these small things and reassure the mother first, which is going to be important.
Okay. So Shanti has got a new pump, and after breastfeeding she thinks that she has only 20 ml pumped milk. Will you be okay with that, or you think that she's not doing enough feeding? Ms.
She's
Varsha?
absolutely doing wonderful, because this is the output that she's getting after breastfeeding the baby. So it means that the baby is well breastfed, and even after that she has about 20 ml, which she can actually use it for donation purpose.
Okay. So just because you have some milk in the pump or less milk doesn't mean that you're lactating less. But Saroja is not convinced. She feels that the baby is feeding but has gained only 400 grams in 20 days. How do we convince her? The grandmother is never convinced. So, and that's to Miss Teena.
So we should educate them that breastfeeding baby has to gain 25 grams to 30 grams per day. So if the baby is gaining 200 to 250 grams per week, it's very much acceptable. So nothing to worry. So you need not to see that every time after feed the baby has to, they'll say that so it has to protrude out. So after the every feed, no, we can't see that. Only if you want to measure or see how much ml your baby had, either you have to do pre and post weighing thing, or we have to scan and let the mother know. Otherwise we can't just with a naked eye we can't see and assure that the baby had enough. So yeah.
All right, so convincing is not easy, but if the trend of weight gain is preserved, I think we should all wait. Shanti wants to know what is cluster and dream feeding. Can Miss Varsha and Miss Teena elaborate on this? I would like Miss Teena to speak on cluster feeding.
So cluster feeding is very common during evening hours. So mothers think that, ma'am, after 3 o'clock or after 4 o'clock, when I try to express, it's not coming out. So we have to educate them on how their breast is working. So initially from the morning, if the mother is expressing the milk, they can see a diluted milk. So more of fore milk. So after few hours, maybe probably after 3 o'clock or 4 o'clock, when the mother is trying to express or hand express, they can see only a few drops coming out. So they think that the milk supply has reduced, but the thing is, the fat-rich milk started coming in after few hours of the day. So the baby needs support from the mother during evening hours for sleeping. So definitely we can encourage the mother to continue cluster feed. So it doesn't say that you have to offer the breast for 3 hours or 4 hours to make the baby sleep. So you can feed at least every 40 minutes or 30 minutes, in maybe for 1 or 2 hours they demand for small and frequent feed, after which automatically baby will sleep. So yeah, cluster feed is acceptable, definitely.
Okay.
With dream feeding, usually dream feeding is recommended during the growth spurts or immediately after vaccination, that period, 1 or 2 days post vaccination. What happens is dream feeding when during growth spurts, babies refuse taking milk because of some discomfort, that the changes that are happening in their body. Because they are having a rapid development, the baby has to double the birth weight in 6 months and triple by 1 year. So the changes are very frequent, and especially during the teething time, the babies get very irritated. They just don't want to feed. Or even, as ma'am said, when during the baby is having a nasal block or something, babies will not want to feed. They'll keep rejecting. So this is the time when baby is in a half sleep mode, or is just about to get up from a nap. That is the best time to offer. Dream feeding works wonders for, it becomes very easy for the mothers to handle during these tough times. This is the best option to go ahead with.
Okay. So Shanti is in tears because she says her back hurts and her neck hurts. And how can I feed comfortably is a question to Ms. Teena.
So if the mother is very exhausted, definitely we can advise a lying down position or side lying position. We can also ask the mother if she is comfortable expressing and giving through palada or spoon or any other alternatives. You can also encourage the partner to support the mother. The main thing is, so most of the time newborn babies are very demanding for the mother. So it's very important we should bring her partner in the picture, because I agree most of the partners are very supportive these days, but 20% of the partners are like, these are women thing, I should not do these baby carrying work or changing diaper or whatever, burping or whatever things. So if we bring partners into that picture, we can ask my mothers to express and feed the milk through palada, or we can encourage the mother to feed using side-lying position or laid-back method if she is comfortable. And there are myths saying that side-lying position and if the mother and baby are feeding in side-lying position, baby may develop tooth decay or some other issues or ear infections. We don't have any evidence-based study saying that baby will develop dental caries or ear infections. So we can encourage the mother to do side-lying feeding in front of or with the supervision of any family members.
So she can lie down and feed. She can choose a comfortable chair to sit. She can have a foot rest, and there can be somebody to help her at a latch. These are small things that can make a lot of difference in the mother. Shanti's story and reels are a big hit in the Insta profile because she's doing such a wonderful job as breastfeeding. And suddenly she gets a free access like this. Someone who's saying that you should take so much protein, so much caffeine, so much alcohol. Can we allow smoking and alcohol during breastfeeding? This is to Ms. Teena.
So smoking and alcohol is not recommended. So most of the time, if the mother want to take a standard, standard in the sense medium size of a drink, she can go for it. So if she decided to have a drink, standard portion of drink, so she has to plan priorly, consider pumping and giving the milk to somebody else. Then she can go for a party or any events if she has some commitment. So if she doesn't have any backup or any partner to take care of the baby better, she should avoid all these smoking and alcohol. And if she has a newborn baby or 3 months old baby, definitely she can eliminate all these habits. Maybe older babies can eliminate alcohol better rather than the smaller one. And if she is taking 2 drinks or 3 drinks, it takes time. For example, if she is taking more than 3 or 4 drinks, it takes 6 to 8 hours to eliminate from her bloodstream. So, and when it comes to smoking and vape and everything, so smoking, they are not allowed. It's not like they should not do. They can limit the usage of cigarettes, maybe 1 or as less possible. So it has major effects on a baby's respiratory system and other diseases. So vaping is also the same. So if the mother want to do smoking, consider smoking outside of the house, and also she should change her clothing when she handling the baby. So that is also very important.
So with regards to alcohol, only beer or wine is allowed. It's about 5% beer and 11% wine, and the quantity is restricted. Smoking per se should be avoided, and drugs of any form is not allowed. And Shanti has a comment in her Instagram page, and she's been asked by her followers, what is the diet to avoid during breastfeeding? And this is to Ms. Varsha.
Okay, actually the mother, she's not a patient, she's a new mother. So she's absolutely free to have anything that she wants, but anything more is not good. So that is why generally I wouldn't recommend her taking too much of milk to keep herself hydrated. Even water will do wonders for that. So her milk intake per day can be about 200 to 300 ml. And she doesn't have to eat too much of garlic. And nowadays it's becoming like, they boil 2 or 3 whole garlic pods into milk. They boil it and they shrink that milk. Once it is come down, then they drink the whole glass. It's almost like about 200 to 250 ml of milk with about 2 whole garlics. It's like it's a part of a daily diet. I think this can be avoided. So this is one thing that she has to avoid. And outside foods, oily foods, home cooked, anything that is safe is fine. Heavy foods, have it during the day so that she'll have her physical activities to burn out that calories. Towards the end of the day, easy digestible food, that is all.
Done. So Shanti wants to donate milk. She wants to visit Vijaya Niku. How do we promote donation? Yes, Ms. Rupa.
Yeah. How to contact Amritamna? Just nowadays in Google itself, everything is available. By that, they can contact us. They can contact NGOs. எப்படின்னா நீங்க just Google பண்ணா போதும், நம்மளோட கான்டாக்ட் நம்பர்ஸ் இன்ஸ்டாகிராம்ல பிங் பண்ணலாம், FBல வந்து சாட் போடலாம், என்ன பண்ணாலும் சரி. இப்போ அதுதானே பண்றோம், மோஸ்ட்லி அதுதானே பண்றோம். வேற ஏதாவது இருக்கா நமக்கு அது தவிர வேலை? படிக்கிறதெல்லாம் லாஸ்ட் 1 hour தான். மினிமம் 8 hours நம்ம இன்ஸ்டாகிராம்ல ஸ்க்ரோல் பண்றது, ரீல்ஸ் பார்க்கறது தானே. அதே மாதிரி தான் அதுல இன்ஸ்டால FBல சில நல்ல விஷயங்களும் இருக்கு. அது மாதிரி இந்த breast milk donation அவங்க டொனேட் பண்ணணும்னு நினைச்சாங்கன்னா, உங்க ஃப்ரெண்ட்ஸ் ரிலேட்டிவ்ஸ் யாருக்காவது தெரியணும்னு நீங்க நினைச்சீங்கன்னா ப்ளீஸ் டூ ஷேர். ஜஸ்ட் கூகுள் பண்ணி வெறும் breast milk donation போட்டா கூட அமுதம் breast milk donation பேஜ் வரும். அதை வச்சு அவங்க டொனேஷனுக்கு கான்டாக்ட் பண்ணலாம். நெக்ஸ்ட், எஸ் வி டூ கவர் ஆல் த ஏரியாஸ் இன் ஆல் த 38 டிஸ்ட்ரிக்ட்ஸ்ல தமிழ்நாட்டில் every nook and corner of the cities நாங்க கவர் பண்றோம். சோ நீங்க எந்த மூலை முடுக்குல இடுக்குல இருந்தாலும் டெஃபினட்டா அமிர்தம் வந்து உங்ககிட்ட இருந்து மில்க் கலெக்ட் பண்ணி தேவையான குழந்தைங்களுக்கு கொண்டு போய் கொடுப்போம். And then 2 sessions of pumped milk வந்து combine பண்ணலாமான்னு கேட்டிருக்காங்க. Yes, it can be combined. Previous session milk வந்து already chilled இருக்கும். Sometimes it can be in solid state, ரொம்ப frozen stateல இருக்கும். Second pumped milk either in the same day or to the next day also sometimes allow. Just chill பண்ணி mix பண்ணா போதும். ரொம்ப டீப்பா போகணும் இன்னும் நிறைய இருக்கு, but it's just outline. Then is it nutritious? Completely nutritious தான். Of course 1 or 2% is micronutrition கொஞ்சம் லேக் ஆக தான் செய்யும். But பட் கம்பேரிங் டு வேற ஏதாவது அந்த குழந்தைக்கு போய் கொடுக்கறதுக்கு ஒரு தானமா கொடுக்குற தாய்ப்பால் வந்து டெஃபினட்டா அந்த குழந்தையோட பசியை மட்டும் போக்காம அவங்க உயிரியே காப்பாத்துற ஒரு அமிர்தமா தான் செயல்படும். நெக்ஸ்ட் வேலிடிட்டி ஆஃப் ஸ்டோரேஜ். எப்படி நீங்க இப்போ மாட்டுப்பால்ல நம்ம என்ன பண்ணுவோம், காலையில காய வச்ச பால் டெஃபினட்டா சாயந்தரம் மதியத்துக்குள்ள கெட்டு போயிடும் இல்லையா. ஆனா breast milk வந்து ஒரு அற்புதமான விஷயம் என்னன்னா, இஃப் இட் இஸ் டீப் ஃப்ரீஸ் 6 months வரைக்கும் வேலிடிட்டி இருக்கு. டீப் ஃப்ரீசிங் இன் த சென்ஸ் -20 to 24 டிகிரி சென்டிகிரேட்ல, வீட்டு ஃப்ரீசர்ல -4 or -5 டிகிரி சென்டிகிரேட்ல இருக்கும்போது ஜஸ்ட் ஒரு மேக்ஸிமம் ஒரு 20 daysல இருந்து 1 month வரைக்கும் வி ரெக்கமெண்ட். பட் யூஸ்வலா 2 months குள்ள கரெக்ட் பண்ணிட்டு அதை எப்படின்னா பேஸ்டரைஸ் பண்ணி ஸ்கிரீனிங் பண்ணி பேபிஸ் கொடுக்கறனாடி இட் இஸ் ஓகே. தென் பெனிஃபிஷியர்ஸ் யாருன்னா கம்ப்ளீட்லி NICU பேபிஸ், ப்ரீமெச்சூர் சிக் பேபிஸ், ரொம்ப உயிருக்கு போராடிட்டு இருக்க கவலைக்கிடமா இருக்க, அதாவது ப்ரீ டேர்மா பிறக்கிற பேபிஸ் பிலோ 36-37 வீக்ஸ்க்கு பிறக்கிற பேபிஸ்க்கு மோஸ்ட்லி 99% டோனர் breast milk வந்து போய் சேருது.
Thank you. So 44 slide waiting. Okay. Now Shanti has had a wonderful journey. She's been super good, and then she delivers the next pregnancy with twins. And what do we have to do for the twin babies? Can an LC offer a possibility of feeding twins, Miss Varsha or Miss Teena? Anybody can take this question.
Yeah, actually, mother can breastfeed twins together. ரெண்டு பேரும் ஒண்ணா feed பண்ணலாம். That we called it as tandem feeding. So the best position also would be like football hold. She can feed both the babies at the same time, or she can choose to feed one baby at a time also. Absolutely, a mother, even with recently there's a mother whom I've seen. She had a triplets and she is breastfeeding all the 3 babies. So twins, yes, it is possible.
Thank you. So the take-home message is nothing is impossible in feeding breast milk to babies. Together we can do it. And family to be a part of breastfeeding. Lactation support team is the cornerstone in establishing breastfeeding. And we all should understand that it is not a one-person job. It cannot be just the obstetrician, neonatologist, lactation consultant. It is more of the family and society like you. Future nurses and future mothers and fathers have to have this idea in mind to come into full breastfeeding. Thank you so much. I thank my panelists for having had a patient session with me and going through all the slides. Thank you so much.